Hello and welcome to UTRGV Radio's Health Talk. I'm Annette Del Toro, your host, and I'm here today with Dr. Hugo Rodriguez, an assistant professor in the Department of Health and Biomedical Science at the University of Texas, Rio Grande Valley. We also have Senior Biomedical Science Nitchelle Rodriguez, president of the Medical Brigades chapter here in Brownsville. Today's topic is the purpose of the Medical Brigades and its recent trip to Nicaragua. Good morning, Doctor.
Good morning, Annette.
How are you today?
We're doing well, thank you. Thank you for the invitation.
No, thank you for attending at this chapter of Health Talk. At the beginning of the semester, Dr. Rodriguez guided a group of students from Brownsville to Nicaragua for Medical Brigades. Dr. Rodriguez, can you please tell us the purpose of the Medical Brigades?
Yeah, Medical Brigades, it's an international organization created with the goal of exposing students to real scenarios to where they can apply knowledge previously acquired or in the classroom or in daily activities, but specifically more targeting pre-medical students with the idea of expose them to real life activities.
Okay, and what interested you in going to Nicaragua?
Basically, the interest was coming from the students, and Ms. Rodriguez, Nitchelle, and a group of students, they took the lead and create a chapter here in the Brownsville campus, and they invite Dr. Castañeda, another faculty member in our department, and myself to be part of this amazing experience. So I'm very glad about the opportunity. That's how it was created. It was basically the students took the lead on creating this or looking for new opportunities.
Awesome. And when did this trip take place?
We went to Nicaragua in the last weeks of August. We spent there 1 week over there. We spent a few extra days because when we were close to leave Nicaragua, we had the Harvey hurricane. So coming back to the States, coming back to Brownsville was a little bit bumpy. So we have to do some different strategies and travel through the States to finally went back to Brownsville, ready to start the semester without missing classes.
Yeah, wow, it was a complete experience.
Oh yeah, it was totally completed.
Okay, and what did the Medical Brigades do in Nicaragua?
As I told you, Annette, Medical Brigades, it's an international organization, and there's more organization very similar to this, with the idea of, as I was telling you, to expose students and help students to experience real life activities in an underserved population, like in this case, Nicaragua. There were also in Peru, they were in Haiti, some chapters are including even in Africa. So the students chose Nicaragua because we saw a good opportunity for learning and for serving the community. And as a plus will be the practicing Spanish for our students. And knowing that medical Spanish is an important element of the curricula, which is not included as a class, but having the students learn how to speak in Spanish, especially within clinical settings, was a great opportunity.
Yes. And did you accomplish what you set out to do during the trip to Nicaragua?
I think yes, and I will say I'm very pleased that not only we were able to complete the task, which was providing health services to different populations in Nicaragua, but also some community service projects. But I think more than that, the opportunity that the students have, and including ourselves, to learn from a different culture, to understand the health disparities that occurs in Nicaragua, and then compare and contrast with health disparities we have here in the Valley, was a great opportunity for students to learn. We were also very pleased that when we think about going there, we were discussing the possibilities, that students are used to the comfort of their own houses, having air conditioning, eating the food they like, and stuff like that, will be could be a
Little
let's say yeah,
sacrifice.
exactly an issue. And I can tell you, none of the students who were there complained about anything. They were really work in the most professional way that you can imagine. We were so pleased
Wow.
and we were so proud of the students because this is was a student oriented, was a student created and a student oriented, and the students really we were able to see the students how they develop the professional identity that is needed as part of the pre-medical program.
Oh wow, that's incredible, you know.
Yeah, there was no hot water. They have to share rooms
What
using
about the
bumping
food?
beds, eating the same food 3 times a day for 7 8 days, and with no complaints. Eating in not in a perfect setting. Sometimes we have to sit at the floor, surrounded by dogs, and in a hurry because there's a lot of patients waiting for us to interact with them and help them. So it was challenging, but I can tell you uh, the way that the students behave for me, it's a plus in professionalism.
Wow. And as part of this, your service during Nicaragua, how many patients did you see?
We had 3 days of clinical activities in which the students were distributed, and I think Nitchelle probably is going to tell you more about her perspective. So the students were distributed in different services, including family medicine, dental services, a little bit of OBGYN, a preventive kind of early detection of cervical cancer and breast cancer. But also we have the students who were assigned to the bioinformatics section, in which they have to collect all the data that we get from patients regarding the type of diseases, age of the patients, number of patients. So in the 3 days that we had activities, we saw more than 870 patients, close to 900 patients. It was a full day, and as I told you, there was no breaks except a lunch break, which was 30, 40 minutes at the most. But always see the students, they see you. Nobody complains, as I told you, and the kids came always back. They go back to their activities with a smile and acknowledging and humble to do this type of activities. And then when we went back to the hostel where we stay, the activities continues because we need to be prepared for the following day. We need to complete the task, mostly the statistical analysis of the data, and something which we always promote, which is the reflection of the activity. So we have some charlas or some debriefing sessions where we learn more about the culture, but mostly we reflect about the experiences that we have at the end of this day.
Wow. And how was this trip funded? We know that a lot of students attend to this trip.
Yes,
How it was funded?
the funding was basically done by the students. They work really hard, and this is another of the things that I want. I'm very grateful how the students work and with a good leadership, but also as a good members of a big team. So there was a lot of teamwork. The work was distributed. I'm sorry, in between the members, the officers, and the members of the association. So they fundraise a lot, and then we got help from the student of global engagement, who was a
As part of the
great
international students.
yes, a great supporters from for the project. Yeah, they were fantastic supporters. They help us a lot. They make all this process really. I don't want to say super easy because we
Smooth.
were but very smooth because we never did this one. The students, Nitchelle, and the officers, they don't know how to do it, and so we learn on doing the job and was very smooth, as you said. and was a lot of help. Families and members of the community. We had sponsors who provide us with some of the toiletries that we have to take, because as part of the program we need to bring money for medications. We need to have toothpaste and toothbrushes for provide
to donate to people
and use
community.
as part of the workshops that we did with the students, with the kids. So we promote dental hygiene and hygiene as a preventive way for diseases.
What would you like to do if you will return again?
Now that we know, because for us, I never did. I did some like this when I was a medical student, but that was 40 years ago. So now it's totally different. I think we were well prepared, and probably in my one of in the debriefing sessions, for example, we saw a lot of patients dealing with sight impairment. So if we go back, I think we will be try to fundraise or collect some of the eyeglasses, reading glasses for some of the patients, and create a section where we can be diagnosing eye impairments. Eye impairment.
I can imagine that as you already know the necessities from the community in Nicaragua, you will now be able to see what to ask for students and families to raise. Okay, you're listening to Health Talk on UTRGV Radio. We will return after the break.
Nossa, nossa, assim você me mata. Ai, se eu te pego, ai, ai, se eu te...
Welcome back to Health Talk on UTRGV Radio. I'm Annette del Toro, your host. Our guests for today are Dr. Hugo Rodriguez, an assistant professor in the Department of Health and Biomedical Sciences at the UTRGV, and student Nitchelle Rodriguez, which is the president of the Medical Brigades chapter here in Brownsville. How are you, Nitchelle?
Hi, Annette. I'm good, thank you.
Okay, we were talking about their experience in Nicaragua, and Nitchelle, what did you gain from this experience?
As a student from this trip, I believe that I learned a lot in, like Dr. Rodriguez mentioned, in professionalism. We were also able to learn how to apply our knowledge to the healthcare environment in any type of area. And really, this experience helped us as students to be more compassionate towards our patients and really get to know them, learn more from them, be in a scenario where we had to think very quickly. So that's how I think we were able to be benefited from our brigade.
Okay, and what were some of the medical procedures that you performed during your time in Nicaragua?
Well, since most of us we are undergraduate students, we didn't really have any licensing on to do any type of open would you call it an open procedure? I think yes. So mostly what we did over there, we worked mainly in the triage area and shadow in all of the other areas. So for the brigade, the model that they have it separated is that the first contact comes in the triage, then they do consultations with the doctors, then they go to dentist, and they can either go to any work that they need to be done in the OB section or go to the charla, and then finally they can wait in pharmacy. So we as students, we worked in the triage section and we performed blood pressure readings, we took temperature, we took weight, and we did the first medical interview to know about their history, maybe previous allergies, and all of that. From then on, we were with the doctors, and we helped them in anything that they needed. Maybe listening to their hearts and breathing and practicing kind of like that. In pharmacy, we were also running that section. So basically, we got the paper from the medications that were prescribed from the doctors, and we collected all the medications needed into a little bag, which was really interesting because after you are able to go through all of the stations, you're able to kind of match the diagnosis with the medication needed. So that was really interesting, something really interesting to learn. We also ran the charlas by ourselves, so we prepared like health topics, and we did posters. We also did like interactive activities, and we basically talked to the little kids, ages around 2 to 9, more or so, about some hygiene, things that they could do to change to better their health, also nutrition and hand washing. So yes, so we did a lot of stuff. We were
a little bit of everything.
A little bit of everything. We all got to experience something. But yes.
Okay, and what were some of the difference that you noticed in comparing medical service in the USA to those in Nicaragua?
Yes, so Nicaragua, we really saw that there's a big need for healthcare. Most of these communities, they're on the outskirts of major cities, probably like 30 to an hour away. And most of them, they don't have transportation, so they actually rely either on buses or long walks. So their access to healthcare is very limited. Most of the times, it's either to an hour or 2 hours away. So we did see that most of these community members, they actually hadn't seen a doctor in maybe more than a year or more than 6 months or 2 years. Yeah, so they don't really have that access to healthcare. And when they actually do is in this type of community works where they're able to see doctors either volunteering or brigaders like us bringing healthcare to their communities. So we did really see a lack in healthcare in that area. They also don't have really a lot of access to services such as laboratory work or other type of CAT scan examinations, more lab work. And that aspect is mostly, if they do get an interaction, it would be physician and patient. So even though that's good that they were able to get that type of consultations during this type of brigades, it is something that's really lacking because that's when you can actually diagnose more underlying problems in their health. And yes, in comparison here in the U.S., I believe that we have more access to that. We see doctor's office almost everywhere we go in our city, and it's more accessible than over there.
Okay, so you're listening to Health Talk on UTRGV Radio. We will return after the break. Welcome back to Health Talk on UTRGV Radio. I'm Annette Del Toro, your host, and our guests for today are Dr. Hugo Rodriguez, an assistant professor in the Department of Health and Biomedical Sciences at the UTRGV. I'm also here with Nitchelle Rodriguez, the president of the Medical Brigades chapter here in Brownsville. The topic for today is to know about more about the experience from the Medical Brigades to their recent trip to Nicaragua. Nitchelle, what did you choose to go to Nicaragua with Medical Brigades?
Well, so first of all, we chose to go with the organization Medical Brigades, mostly because we were really interested in the approach that they have when serving these communities. They actually have a holistic approach in which their goal is to empower the communities in every area. So not only in a medical aspect, they also worked in, for example, business, microfinance, public service, water services in the communities. So once the brigaders actually leave the community that we worked in, they still work with the communities in all of these other aspects, so that at one point in time they don't need to rely on outside organizations from the United States, and they can actually work to improve their situations by themselves. So I think that that is actually really important for the communities to not just receive medical help, but also help in all of these other areas in law and microfinance. So we chose to go to Nicaragua because it was a country that really spoke to us, as it was a Spanish-speaking country. It was also in Central America, so a comparison to other ones, for our first time, we didn't want to go that far away, like to Africa or more south in South America. So that's why we chose Nicaragua. And yeah, it was a really fun country to go.
Are you planning another trip, and where will you go?
So yes, so this year we're working on our next brigade, and we have decided to serve in the communities in Cusco, Peru. So that's where we will go next year, 2018, probably around May.
Okay. And aside from the trip, how else this organization involved in serving the community?
So we as organization for Medical Brigades, we also like to focus here on how can we help our communities. So we're actually also very involved in volunteer work, not necessarily medical, but also any type of volunteer work. And we also, for the medical aspect, we also helped in the community working in farmers market. I believe Dr. Rodriguez can talk a little bit about that.
Yeah, thank you, Nitchelle. And then as part of the medical brigades, we decide that we need to continue this, and as part of the project, the students are also assist in the community with some awareness events for health disparities like obesity, diabetes, cardiovascular. So we work closely with the farmers market organization every Saturday, and we have a booth where we are conducting some awareness about these important chronic diseases. So the students do again. They check blood pressure, they check pulse, heart rate, body mass index, body fat composition. So, and we see a very a good reception from the community. We have a lot of I don't want to say patients, a lot of people who came, and they want to learn more. There's a lot of education needed right now in our community. So we do that every once a month in the farmers market, and also we had the PUB, the Brownsville Health Fair, who was a few weeks ago here on campus. The students were invited to participate again with a very good response from the community. I think that Brownsville community is looking for opportunities to learn more about these conditions, and I think it's great that the university is involved in this one. And this is one of the many events where students are involved with the community.
Perfect. If we have a student that would like to join these organizations, what are the requirements for joining the medical brigades, and how do students contact the organization?
Okay, so if you're interested in joining Medical Brigades, you can go ahead and contact me, Nitchelle Rodriguez. My email is Nitchelle, NITCHELLE.Rodriguez01@utrgv.edu. You can go ahead and contact me, send me an email. So let me know that you're interested in joining, and I will certainly let you know more about how to join. We also have weekly meetings on Wednesdays at 12:45 at LHSB 1.410, where we discuss the organization, any topics, fundraisers, and basically get together to prepare for our next brigade. So yeah, and we actually do a lot of fundraising to help the students, to lower the costs for the students going on this trip. Because, as you know, traveling, going to another country may be a little pricey, but we try our best to fundraise as much as possible so that students don't have to pay everything out of pocket.
I'm gonna add just a little. I think as a faculty, as a parent, I will always recommend this type of experience in for those students. The Office of Global Engagement have a lot of opportunities for the students to travel, study abroad, and do and learn a lot of about the world, about life, about. It's a great experience because it's sometimes we have the idea that education is inside the classroom, and now our department is focusing in a lot of the teaching outside the traditional way. So the same way we use case studies or we use problem-based scenarios or clinical cases, the students were able to see the reality of this simulation we use in previous classes in when they were working with the community. So my advice, if I can, will be try to do always try to do an study abroad. This will probably will give us because some of them in some of these conditions are classes that will be totally part linked to the project. We are linked to one of our courses, the independent research. The independent research course we have in the department, we have 4. The students before graduate, they need to complete independent research 1, 2, 3, and 4. And so we use one of these courses to link with the Global Brigades experience. So after the students went to Nicaragua for a week, plus the weekends, but we have weekly meetings with the students where we discuss. So this is a class, this is a course. So we use the experience obtained during the trip to complete the requirements of the course.
Okay, so they did receive credit for this trip.
Yes.
Okay.
Yeah, this is kind of a study abroad. That's why the Office of Global Engagement was involved. Not only because of that, because you can use the Global Engagement office and no credit is going to be linked to the experience. But the majority of the study abroad programs that I know, I don't know a lot, are linked to a course. So it's a plus for the students because they can take a very interactive, a very fun experience, a very rewarding experience, especially in this case.
Okay. Well, today we talk about the Medical Brigades organization, and we learn a little bit more about their recent trip to Nicaragua. Dr. Rodriguez, Nitchelle Rodriguez, thank you for being our guest today on UTRGV Radio's Health Talk. Dr. Rodriguez.
Thank you, Annette. And again, you can students can contact me if they want. My email is my name, hugo.rodriguez@utrgv.edu. My office is located in LHSB building 1.412. And they can also look for us on the Facebook page for the Global Brigades.
This is Annette Del Toro. Thank you for listening. Tune in at 11 a.m. next Thursday for another installment of Health Talk.